Begin. Enter the room.
Hello, I'm Dr. Roger, one of the physicians caring for your mum. Are you Mrs. Carol Bones, the daughter of Susan Bones?
Yes, I am her daughter, Carol Bones. Thank you for speaking with me today. It's been such a hard time for all of us, and I just want to know how my mum is doing.
Thank you very much for taking the time to come in today. I understand it's a difficult moment, and I'd like to have a thoughtful discussion about your mum's current condition and outline the plan for her care moving forward.
Is she getting any better at all, doctor?
I want to start by saying that I know this must be an incredibly challenging and emotional time for you. From everything I've seen, it's clear just how much you care for your mum, and I can see the effort you've put into making sure she's well looked after.
Yes, it's been extremely difficult. She's just not the person she used to be, and it's so hard to watch her change like this.
I completely understand how worrying this situation must be for you. Dealing with a loved one's health in this way can bring up so many questions and concerns, and I want to assure you that I'm here to support you through it and help with any uncertainties you may have. Could you share with me what you understand about your mum's health and her current situation, based on the information you've received so far? I want to make sure we're on the same page before moving forward.
Well, from what I've seen, she hasn't been eating properly for weeks now, and the weight she's lost is really noticeable. The nurses mentioned that all her tests came back normal, but I don't understand how that can be when she's so unwell. I just don't get why she's not improving.
Thank you for explaining that to me. It's very important for us to have a clear discussion about where things stand right now and what our next steps should be to ensure your mum's care is aligned with what's best for her. I do need to bring up some serious concerns regarding your mum's health that I believe we should address today. Is there anyone you'd prefer to have with you during this conversation, or would you rather we proceed just the two of us?
No, it's just me here. I really want to hear everything directly from you. Please just tell me what's happening with her.
Your mum has been living with dementia for the past 3 years, and unfortunately, it has now progressed to a point where she is no longer able to eat or drink properly on her own.
But she does still take a few sips of water every now and then. Isn't there something more you can do to make her eat? Is there a way to help her get back to where she was?
I know how distressing it must be to see her like this. It's incredibly hard for families to witness these changes. We've conducted a comprehensive series of investigations, including blood tests, x-rays and scans, and all of those have come back normal. The weight loss she's experiencing is primarily due to the dementia, which has started to severely affect her ability to eat and drink.
Does this mean that she's dying? I wasn't expecting to hear that today.
I'm very sorry to inform you that your mum's condition has now reached a very advanced stage. Dementia is a progressive illness, and at this stage we're unlikely to see any significant improvement.
But I brought her here because I thought you could help her. Why can't you just feed her through a tube or something? There has to be something more you can do to keep her going.
I understand how much you want to help her, but I need to be honest with you. Using more aggressive treatments like a feeding tube at this stage would likely cause her more harm than good. It's an incredibly difficult decision, but right now our focus should shift toward keeping her comfortable and ensuring she's not in any discomfort. Can I ask a little more about how she's been doing at home recently? Has she been able to take any food or liquids at all? Even small details could be helpful.
Barely anything at all. Sometimes she'll take a tiny sip of water, but she won't eat anything, and she's mostly just lying in bed all day. It's like she's not really there anymore, and it breaks my heart to see her like this.
That sounds like it's been a very difficult situation for you to manage. Has she been able to communicate with you in any way, or has she been able to recognize you when you're with her?
No, she hasn't recognized me for a while now. She sometimes yells out, but I don't think she knows who I am or where she is anymore.
It's clear to me that you've been doing everything you can to care for her, and I can't imagine how challenging this must have been. How have you been managing her meals and hydration? Has she needed help with every meal, or has there been any time when she could manage a little bit on her own?
Yes, I've been trying so hard to feed her, but no matter what I do, she just won't eat anything. It's absolutely heartbreaking to go through this and feel so helpless.
You've shown an incredible amount of strength throughout this, and it's obvious how much love and dedication you've given to her care. Unfortunately, As dementia progresses, it can cause people to stop eating and drinking entirely. It's one of the most heartbreaking aspects of the disease. I know this must be incredibly hard to hear.
So there's really nothing more that can be done. I feel so lost right now. It's hard to accept that this is it.
At this point, the best course of action we can take is to focus on her comfort. We've already referred her to palliative care, which is a type of specialized care aimed at managing symptoms and ensuring that she's not in any pain while maintaining the best quality of life possible.
Palliative care? Does that mean she's going to pass away soon? I don't know if I'm ready to hear that.
Palliative care is really about managing her symptoms and focusing on comfort rather than trying to cure the underlying illness. It doesn't mean she'll pass away immediately, but it does mean we're changing our approach to ensure her final days or months are as peaceful as possible.
I just don't want her to suffer any more than she already has. That's the most important thing to me right now.
I can understand how difficult this shift might be to accept. Please know that we will do absolutely everything in our power to ensure she remains as comfortable as possible. If it's something you'd like to explore, we can also discuss the option of having her cared for at home. Many families find it comforting to have their loved ones in familiar surroundings during this time.
I would love to have her home where everything is familiar, but I don't know if I can manage her care all by myself.
We would be able to arrange for support services at home, including nurses to help with her daily care and other assistance you might need. Does this sound like something you'd like to consider at this point?
Yes, but what if something happens to her while she's at home? I'm so afraid that I won't know what to do in that situation.
That's a completely natural concern to have. We will ensure that you have the necessary support and resources to care for her at home, should you choose that option. It's important to keep her environment peaceful, play music that she enjoys, hold her hand and help her drink small amounts when she can. We can also provide you with guidance on caring for her, such as how to keep her mouth moist and how to talk to her even if she's unable to respond.
Thank you for saying that. All I want is to make sure that she's as comfortable as possible and that she knows she's loved.
You've done an incredible job caring for her so far, and we can also refer you to social services for additional support or even hospice care if you ever feel you need a break.
That sounds like it could be really helpful. I hadn't thought about hospice care before, but maybe that's something I should consider.
Hospice care is designed to give you the support you need without taking away from your role in her care. It's there to assist, not replace, what you're already doing.
Yes, that sounds good.
We'll also provide you with written information on palliative care and other resources that could be of help to you during this time. If you ever feel uncertain or need assistance, please don't hesitate to contact us. We're here for you both.
Thank you, Doctor.
We'll arrange for a follow-up appointment in the near future to review your mum's condition and check in on how you're doing. Please take your time with everything, and remember, you're not alone in this.